today we're going to talk about rehabilitation. Now, there's all sorts of rehabilitation. There's rehabilitation from addiction. There's rehabilitation from divorce. There's all sorts of rehabilitation, but the kind that we're really going to focus on today is when someone has some very serious surgery, whether it's on their hip or their shoulder or their knees, and they can't do this alone. They absolutely have to have experts, and it depends where you go also for this rehabilitation. And I soundly hope you'll go to Regents Park of Boca Raton because they are very, very experienced there. And to tell us all about this is Rachelle McCue, and she has all sorts of degrees to have learned all the right things to do, but more importantly than that, she is at I'll call it a facility. It's a rehabilitation facility that is so experienced and has every piece of equipment that's required. So welcome to our show. After all that, Rachelle.
Thank you, Anita. It's a pleasure to be here.
And you know, when I say every piece of equipment, there are rehabilitation facilities, that at least they call them that, but they don't have the latest and the greatest paraphernalia, I'll call it devices, things, besides, of course, people like you and your experts, but they don't have the very latest. And that does, I think, take away from their rehabilitation, doesn't it?
Absolutely. One of the benefits we have at Regents Park of Boca Raton is the fact that we have 4 different treatment areas with the best and the highest quality and the most advanced equipment that really is out there. And we don't just have one piece of equipment. We have multiple pieces of equipment as well as treadmills and new steps, which is kind of like a seated Stepmaster, kind of a bicycle, standing tables, but also all of the technological modalities such as ultrasound, vital stim, which is so necessary in swallowing rehabilitation, electrical stimulation, to really address any ailment that you might have post-surgery, post-illness. It's not, rehabilitation is not just for post-surgery. It's post any type of medical illness that you might have where you had a hospital stay and you just are not back at your prior level of function. And so at Regents Park of Boca Raton, we're really able to get you back to that prior level quicker than most places because of the advanced technology, equipment, as well as the expertise and the experience of our really large staff that we have there of skilled therapists.
Well, that's excellent, and I know that to be so true because I have been there many times. I have met so many of the therapists. But I had a few questions. If someone is home and they need some speech therapy, or they're just not physically able to do a lot of things they used to, what does it require for them to go to Regents Park?
Yes, anyone who is at home, and this could be that they're just at home and they kind of feel like they've declined a little and they're not as strong as they used to be, or it can be that they actually had an ailment, went to the hospital, and maybe went straight home from the hospital, or went to the hospital and went to an inpatient unit first and did have some inpatient therapy. Irregardless of the reason, anyone who is living in their home environment who feels that their ability levels, their mobility is not up to par, not to where it once was, they're feeling weak in any way, and they feel they require either physical, occupational, or speech therapy, all they would need to do is go to their primary care physician and get a prescription. And the prescription would be for the type of therapy they need, whether it be physical, occupational, and or speech therapy. The doctor would then indicate how many times a week he wants that person to participate in therapy. In an outpatient setting, it usually is 2 to 3 times a week. And the doctor on that prescription will also give some type of diagnosis that's related to why the patient is in need of physical, occupational, or speech therapy. At that time, all you need to do once you have that prescription is to call us at Regents Park of Boca Raton, and we will set you up to come in, and we will take your information, process your prescription. We do all of the insurance verifications for you. It's really that easy. We do all the work, and we set you up for your first evaluation and treatment session.
Wow, Now, that's a very good point. I don't think that a lot of people knew that. I'm glad you talked about that. The other thing is we know that there are some people who have mild forms of dementia, whether it's Alzheimer's or from something else. When you get them into your therapy, how do you deal with that?
Okay, well, that's why it's so important to have a large therapy staff as well as a therapy staff that has many years of experience under them, like our therapy staff does. Our therapists are really very skilled and knowledgeable in dealing with not only all of the typical medical diagnoses as you would think of, hips, knees, someone has pneumonia, so they get weaker, but we are also very skilled at dealing with all the different cognitive diagnoses that could lead to someone not being as alert or as oriented as they used to be, having some periods of confusion. And you really then need a therapist who is skilled with working with that type of clientele, who has experience in getting people to participate and to motivate them to participate in their therapy so that they can get the physical benefits, even though they may have a mild dementia or even a moderate dementia for that matter. It's really important when you choose your facility that you are going to go to for your therapy, whether it be inpatient or outpatient therapy like we're discussing today, that you choose a location where the therapists are very skilled in dealing with patients who have some type of cognitive impairment, because if you don't have that expertise in that therapist, you're not going to get the absolute benefit that you would when you are working with someone as we have at Regents Park of Boca Raton, who has that type of experience with dealing with patients who are having those difficulties.
Well, that's a great answer. I really appreciate that. I've never ever asked that of you before. I want everyone to know you're listening to Rachelle McCue. She's Director of Rehabilitation at Regents Park of Boca Raton. And if you would like more information, you can call them at 561-483-9282. I'm going to repeat that number. Get your pencils out. Remember, this is Pencil Talk Radio. We invented that name a long time ago because a lot of people want the information, and then after I say it, it's lost. So get that little pad that we've talked about. Put this number down, 561-483-9282. And for those of you, and we know a lot of our listeners now are on the web, this is their website that you can find so much information, just as Raquel was talking about. It's called regentsparkboca.com. regentsparkboca.com. Well, Raquel, I know that you are in charge. It's a very big responsibility to be Director of Rehabilitation at a facility as large as Regents Park. And tell us how you kind of worked your way up to something like this. You're so young.
Well, I may look or sound young, and I appreciate that, Anita, but I'm not that young. But no, I received my undergraduate bachelor's as well as my master's degree at University of Arizona, which is the third-ranked school in the nation for speech-language pathology and rehabilitation. And from there, I had worked in the VA in Tucson and worked with all of our fabulous veterans, and then moved to Florida with my family, and I worked at West Boca Medical Center as well as Delray Medical Center and Pinecrest, all very great hospitals and facilities for rehab, and got a wealth of experience. And then I decided that I wanted to move into more of a role where I was dealing primarily only with the geriatric population, which is my love, and dealing with patients not in the hospitals anymore when they were 1, 2, 3 days after surgeries, but really dealing with them when it was most important during their inpatient as well as their outpatient recoveries. These days hospital stays are so short, you're not able to really see or do or affect as much change in your patients, because with Medicare and HMOs today, they're really getting you in and out of the hospital quicker than they used to. And so it's so important when choosing your inpatient facility or choosing where you're going to go for outpatient therapy services that you choose the right place, because those are the facilities that are truly providing you with the amount of care and the type of care and the bulk of the care that is leading to your prognosis and your recovery. And I looked around out there, and I live in South Florida, and I wanted to go to a facility that I knew that I would be proud to work at, that had a great reputation and also had a great therapy and nursing staff already in place. And I found Regents Boca, Raton, and I started there as their head speech pathologist for 2 years, and then shortly after that I became the director. And I've been in the building now for over 11 years, and the majority of my staff has been with me, for that amount of time as well. So we, that says something about a program when you have the same therapist, working together, just adding to the team, adding to the wealth of knowledge that we have, so that we can do the best for our patients. And Regents Boca Raton is a fabulous facility. And one of the things that I want to make sure that everyone's aware of is your doctor will decide for you whether you need inpatient or outpatient therapy services. If you go to inpatient therapy services first, I urge you to choose Regents Boca Raton as your inpatient therapy program. One, because we are absolutely fabulous and we will get you back on your feet and get you home quicker than most facilities will. But because we also offer the outpatient therapy services, which was what our focus is today, you're able to come from the hospital, go to inpatient therapy services, go home, but then come back to us for outpatient therapy services. And we will do our best to give you the same therapists who already know your case. You don't have to start over. You don't have to start from ground zero and start filling, people in on everything that happened to you since you went to the hospital after you got sick. I think, for the population that we're talking about, that's one of the most annoying things, is having to tell every doctor what happened, every nurse what happened, every therapist what happened, having to tell all those details over and over and over again. By coming to us for inpatient and then returning to us for outpatient, you don't have to start over again. We already know you. We know what you're capable of. We know your history. We know your backstory. And we know quicker than anyone what we need to do to continue to progress you on your recovery in therapy during your outpatient therapy services.
Wow, that is so important. See, it's funny. I had someone who was in the hospital, and she had all different kinds of doctors. She has cancer, and this doctor said that, and this doctor. Then when she went to a new primary care, she had to try to collect all that, and she's in no condition to do that. And then how could they even judge what's her problem?
Right, and we do all of that for you. We make it very easy. We get all the information for you. If you came to us as an inpatient, we obviously already know you. But even if you're someone in the community who is in the home and has never had the pleasure of being in our facility as an inpatient or coming for outpatient services, you can be brand new to us, and we would love to have you strictly as an outpatient patient as well. But we will go ahead and we will do all the legwork for you, getting all the information with regards to, what has happened to you, what your ailments are, what your condition is, so that you don't have to do that. We try to make it as user-friendly as possible. We do all the work and you get all the benefit.
Well, it's really important that you share that, because it's not only that it's confusing, it's dangerous if people don't know what your condition is and they go ahead. It's almost like a detective. They start figuring out this or that. They make wrong decisions. So I think what you're doing, is this all on computer?
Yes, we are completely computerized. Like we were talking before, all of our equipment is state-of-the-art. All of our devices are state-of-the-art. Our therapists actually have portable iPads that they use where, basically it's an iPad that fits in their pocket, and any moment in time they could whip that out and pull up your entire medical record and have it right in front of them at their fingertips, knowing all your diagnoses, all your precautions, all your medical history, all your medications. There is no guesswork with us. We really make sure that we know the patient inside and out, so that A, we don't do any harm, but B, that we can truly tailor and customize the therapy experience for each individual patient. You're not going to get the maximum benefit if you're just receiving cookie cut therapy, which is a lot of what is happening out there. you will get the maximum benefit when your therapist knows you inside and out, and they truly custom make and tailor make a therapy program that is specific to you, specific to your activity tolerance, specific to your medications, specific to your diagnosis, specific to your cognitive level. And we really go above and beyond to make sure that every resident, every outpatient, every inpatient has that quality of care.
Your enthusiasm certainly comes through these radio waves. So it's very important that people...
Well, yeah, I appreciate that.
Yeah.
I appreciate that. I love what I do, and I have to say that I'm very proud that I have a team of therapists underneath me. It's close to 25 therapists we have at Regents Park, Boca Raton, and they are all as equally as enthusiastic as I and educated as I, and really committed to their patients. And I'm very proud to have them working under me. It's an excellent team, and a team that if you ever needed therapy, I don't wish it on anyone, but the longer we live, the more likely it is at one point in our lives we're going to need either physical, occupational, or speech therapy. And if you ever need any type of therapy service, whether it be inpatient or outpatient, Regents Park of Boca Raton is really the place to go. You'd be in good hands.
Yes, sounds like that. I wanted to pick up on something that you said because I wasn't aware of that. Your specialty is speech therapy. Sounds like that's what you mentioned that's how you first came as
yes, that's correct.
speech therapist.
Mm-hmm. I am. I'm a speech language pathologist. My master's and bachelor's degree are in speech and hearing sciences. I am multiple certified with specialties in Parkinson's, as well as swallowing, as well as stroke, all different types of neurogenic disorders, trach patients, pulmonary patients, really the gamut. I was the head speech pathologist over at West Boca Medical Center for many years, as well as one of the lead speech therapists over at Delray Medical Center for many years before I landed at Regents Park of Boca Raton. I'm happy to say that our speech therapist, who is the one who's primarily providing the therapy, is as equally educated and qualified as myself, and we constantly talk about patients and ideas about patients. We're both certified in Vital Stim. Vital Stim is a very specialized therapy that uses electrodes for residents who are no longer able to swallow or are having swallowing difficulty. And it's a very specialized expertise that many speech pathologists are not certified in. We're both also certified in Lee Silverman voice treatment, which is a very specialized certification for working with Parkinson's patients. And my other therapists in physical and occupational therapy also have a multitude of education and specialties that they, are in. And, amongst the team, I think that we basically have a therapist who's qualified or specializes in every diagnosis out there. And that's why, with our team at Regents Park of Boca Raton, you would really be in incredible hands when it comes to any type of physical, occupational, or speech therapy need.
Sure sounds like it. I want to stick with the speech. I have a question. It
Sure.
seems as people age, their vocal cords? What happens that their voice is not strong? I mean, I have a strong voice, so am I going to say that when I'm 90, I could have a different kind of a voice?
Yes, actually, there is a whole area of speech pathology that just looks at listening to someone's voice and determining what gender they are as well as what their age range is based on what their voice sounds like. And yes, as we get older, the vocal cords do get less flexible, and it does change the tone and pitch of the voice. However, what a person has done across their lifetime, whether they were a smoker or not a smoker, whether they kept themselves well hydrated, whether they had reflux, whether they had reflux and then stayed away from spicy foods and participated in good vocal hygiene, will determine also the effects of what happens to a person's voice. When you talk about the idea of not having a loud enough voice, you're really talking about the pulmonary system as well as the laryngeal system. In the pulmonary system, that's the lungs. So, and basically the air that comes from the lungs is kind of like the gas that pushes your car. So the air and the pressure of the air coming from the lungs is the gas for your voice. And then your vocal cords themselves is almost like the pedal. When you push on the pedal of a car and the car starts moving, when the vocal cords beat together and vibrate, that's where voice is generated in the larynx or in the laryngeal system. And then as the voice travels up the pharyngeal system or the pharynx, or a very fancy way of saying your throat, that's where the sound is shaped. And then it goes into your mouth and continues to be shaped, and then it comes out of your lips. So, you know, we all talk and we don't think about talking, but here you now learn that you have the pulmonary system, the laryngeal system, the pharyngeal system, and the oral motor system that are all necessary in creating voice and shaping voice and your ability to talk. So anything that, you know, can happen to you that affects any of those systems, let's say if you had COPD, or you had a pneumonia, or you have maybe vocal cord cancer, all of those things can affect your voice as you age. And it's a very delicate system. And the better you care for yourself, the better your voice will maintain. So no smoking, stay well hydrated, stay away from spicy foods, participate in good vocal hygiene. Don't participate in vocal misuse and abuse, which is, you know, yelling or screaming or, you know, clenching down on your vocal cords. Those are things to stay away from, and that's how you preserve your voice as you age normally.
And so you can actually help someone, because I know someone who really, I notice his voice is less. I mean, it's less powerful, and he wants it to be more powerful. So if someone like that, for example, went to his primary care physician, he could then explain what he wants, and then if he got a prescription to go, is there something then you would teach him if he doesn't have any visible problems? I mean, not smoker.
Absolutely.
You could actually help increase his voice.
Absolutely. There are plenty of people who don't have a visible vocal cord problem. Visible vocal cord problems are like nodules and polyps. So someone may feel that their voice is weak. They don't feel like they're talking that loud anymore. They go to their ENT. The ENT looks and the ENT says, no, you're normal. But you're not normal because your voice is not strong anymore. We absolutely can take you for voice therapy at Regents Park in Boca Raton and teach you all sorts of compensatory exercises as well as strengthening exercises. So we would be working on breathing exercises to make sure that you had enough gas for the voice, as well as we would be working on phonation exercises, teaching you how to properly generate the voice at the level of the larynx and the vocal cords. And then we will, you know, talk to you and find out, are you doing anything that would be considered vocal use and misuse, or how your vocal hygiene is. And we will teach you different ways to care for your voice, to preserve it, but also exercises to make both your pulmonary system as well as your laryngeal system stronger, so that you can be heard clearly. You know, a lot of times we find that people have a really trouble talking over the phone, because when you're face-to-face with someone, even if they don't hear everything you say, they pick up on the vocal cues, on your gestures, on your eye contact. When you're over the phone, if you have a loved one who lives far away, you can't hear them. That's devastating. Or you have someone in the hospital and you can't talk to them. That's devastating if they don't have that voice to express their needs and their concerns. And absolutely, we can help that with voice therapy. Both myself and Keith, that's one of the things we do with Lee Silverman Voice Treatment. Again, it's a specialty certification that we both have participated in. It's primarily used for Parkinson's patients. However, those therapy tasks work for all patients who are having a vocal disorder. I've done tons of voice therapy with people in professions who misuse their voices, like teachers, hairdressers, gym coaches, people who have to talk in noisy environments for their profession, young people too, people younger than myself, as well as people who are older, who maybe they have some type of pulmonary issue, or maybe just a generalized weakness, or maybe they have a neurogenic issue that is weakening all the muscles. You know, so often we see someone who has some type of condition, and we notice that they're not walking as well, or they're not able to dress themselves anymore. We go, oh, let's go get them therapy. But we don't notice the nuances, and that's why I'm so glad you asked that question about voice therapy. We don't notice the nuances that are going on, that someone all of a sudden is talking softer or just can't get it out. And that's what speech therapy does with voice therapy. So I'm really glad you asked that question. Most people don't know about voice therapy, so I'm impressed, Anita.
Well, I am. You're impressed. I'm impressed. I mean, you are amazing, and I am definitely going to mention this to this gentleman. I am so happy that we've never covered this before. I don't think I've covered this with anybody. I've had speech pathologists on from hospitals, but we usually talk about stroke and all. This was extraordinary. Rachelle McCue, Director of Rehabilitation at Regents Park of Boca Raton. And if you want more information, it's 561-483-9282, 483-9282, or on the web, regentsparkboca.com. Rachelle, you can just go get yourself a big piece of cheesecake or something you would love, because this was just fabulous, and I'll be talking to you more about that.
Yeah, that sounds great, Anita. Thank you so much.
Thank you also, Rachelle. Goodbye.
Goodbye. Have a great day.
You too.